Chris Sullivan, Global Healthcare Practice Lead, Zebra Technologies, Chicago, Illinois. The impact of technology integration in healthcare is slow and steady progress, but very good momentum. If you look back over the last 10 years, we've seen major technology implementations happen. We've witnessed barcode utilization in hospitals. We've witnessed electronic healthcare records. We now have smart medical devices that are IoT devices. We have mobile technologies. We have big data technologies. And as we look at 2019 and we look at 2020, what we're starting to see is the connectivity and interoperability of these different technologies come together. So we see machine learning, we see big data working together. Let me share a few examples with that. We are now witnessing globally in healthcare operating rooms that are running with multiple technologies combined to turn the operating room faster, eliminating 90 minutes a day in cleanup and setup time, eliminating patient information from being disconnected from their family. And these things are being done through smart devices and smart machines working together. So we're seeing predictive capabilities in healthcare happen to improve operational efficiency in that example. We're also seeing better interoperability at the bedside. So we now see that patients can be monitored not only from the nurse or doctor inside the room, but we see patients being monitored in the hospital from far away. We see a nurse or doctor that's 3 doors down who can look and respond to a patient through a smart mobile device. But we also see large hospitals building centralized command logistics centers where you have clinical experts that are in a room and can then communicate in real time to all of the nurses and doctors within the hospital at the bedside. These examples are coming through big data cloud, machine learning, all the other system examples that I gave, health systems, health information systems, smart devices. It's all coming together. So really nice progress with interoperability and integration, but the progress right now is limited to a few examples. Most hospitals are not yet doing these things. The industry is still struggling with how to scale this and connect these technologies efficiently and regularly. Within our company, the healthcare industry is our fastest growing industry. So we've been growing double digits in healthcare for coming on 5 years now. And that's a global statement. So we're seeing a lot of adoption in technology. The reason this is happening globally and in India is that healthcare is behind other industries in technology. So we're slower in healthcare and using the technologies, and countries all around the world want to lower their healthcare costs, but they also want to prevent medical errors. So the best way to make things safer and to make things less expensive is to use technology. Technology saves labor time, but it also eliminates mistakes. Today, healthcare errors are the 3rd leading cause of death in many countries. And it's very unfortunate that many medical errors occur, but these are preventable. By using technology, you can eliminate human error. So we're continuing to invest in technologies to make the workflow accurate and safer, but also friction-free, easier, where there's less glitches, less mistakes. These are where we're putting a lot of our effort in. I see the glitches and errors as big problem. I see that the technologies most of the time are not working properly together. And if we're not careful, we can frustrate the nurses and the physicians, and what sounds like a good idea can actually create bad results through people being burned out in their job or just frustrated and leaving. So the key thing is the industry needs to improve the interoperability. There are so many smart technologies in healthcare. The problem isn't lack of technology. The problem is the technology is not working well together. So open standards by the major healthcare information systems and the healthcare technology companies would make a big difference. Also, having pre-certified interoperability between the systems, so the technology is tested in the lab. So before it is brought to the hospital, it's proven to work versus experimenting at the hospital or at the clinical area. Healthcare organizations need tools and roadmaps to help them implement. There's a lack of knowledge, there's a lack of awareness on some of the technical things too. Well, Zebra is investing a lot of time and money into the interoperability of healthcare. Our company has over 1,000 engineers that focus on technology solutions. 700 of these engineers are working on software. So as an example, we have pre-certified our technology tools and devices with over 35 different healthcare technology companies. So some of the biggest names, or the biggest names in healthcare technology, we are investing time and energy to make sure that our products work out of the box, out of the gate as they start. We're also investing in new products and new solutions as well. Zebra is a market leader in healthcare devices. We have over 370 different healthcare unique products. Smartphones, mobile computers, scanners, printers, RFID, many, many more. We have all these products, and that's our market lead position globally. But what we're investing in is software solutions to make the products be even more effective. So as one example, we've created a IoT cloud-based data platform that can pull in third-party data. So we're now able to pull in medical device registry information and learn about expired inventory or learn about a product recall. And we're working on bringing that information to the point of care. So when a nurse or physician is using our scanner to do barcode medication administration or using a surgical procedure and they're starting with medical devices, we can authenticate or alert them to a problem. This product is on recall and don't use that product, it's not safe. So we're working in the data to combine with the devices to make the integrations easier. We've also acquired a few companies to help make healthcare workflow intelligent. We've acquired a company that monitors temperature. So one of the healthcare medical error issues occurs when a product leaves the cold chain and is no longer, the efficacy is lost. So we've invested in we've acquired a company that can monitor the temperature in real time and alert the clinician that this product's out of the temperature range. These are examples of how we're investing to try to connect healthcare together. Healthcare has the right technology, the connectivity is not very effective, and we are playing a big role in trying to improve that connectivity. Our India plans are to invest in India. We actually have over 1,000 employees that are based in India. So in India, we build many of our solutions. We have many engineers that work in India. And we're also working with a lot of the large healthcare providers, a lot of the large public and private hospitals. And we're also doing a lot of things with the India healthcare manufacturers, with pharmaceutical industry and also medical device industry. So we're doing so much in India, it's hard to describe it all in one sentence, so maybe I'll take it in pieces. We are working with the vaccine manufacturers in India around the temperature monitoring solution. We're helping them make sure that when they produce a product, it's got a temperature monitoring indicator on the product. So when the vaccine is used in a rural setting, and maybe it's been in transportation for a long time, we help make sure that that vaccine is safe and effective. So we have relationships and investments with many of the manufacturing companies here. We're also working with India health agencies and Ministry of Health around some standards around temperature monitoring, both for vaccines in people and also animal husbandry solutions as well. And so those are some things we're doing with the manufacturers of products here. And I think this is good for India healthcare from an export point of view. I would just like to add some of the hospital examples as well. We're working with some of the largest private healthcare systems. This week we spent time with point of care technologies where we're bringing mobile devices, smartphone devices to clinicians. We just completed a pilot study which demonstrated a 1.5 hour time savings per shift per every single nurse. So basically what our mobile devices are doing is we're connecting smart technologies together. We're eliminating a lot of the busy work, a lot of the paperwork, and therefore the nurses can spend more time with the patients. They don't have to stay overtime to finish their paperwork. It makes for a happier nurse, and it also makes for a safer patient care environment. Our future plans are going to include a lot more software. We're also going to include a lot more artificial intelligence and machine learning. So some examples of things we're working on is augmented reality. So what we want to do is help healthcare workers be hands-free. We want them to be accurate in using technology and tools, but we want them to be hands-free so they can focus on the patient. So we're working on wearable technologies where you can wear technology and get intelligence through augmented reality, where you can visually see and capture information through visual information. So either heads-up displays where their things are on the head or possibly on the armband of a patient. We are also working on exploring natural language processing where we can communicate and have the voice connect to the devices. These are things to try to make the workflow smarter. Those are projects, the two I just mentioned, are things that we're working on now. They're not launched. But last year we launched a IoT data platform to collect information from medical devices, from other software systems that we can then put at the bedside, at the point of care. This is how a nurse can save 1.5 hours of time a day.